afternoon, we are going to talk about children. So this week we are celebrating palliative care worldwide, and our theme is Leave No One Behind, Equitable Access to Palliative Care. So today our focus is going to be on children. Children are very special because when a child is sick, the whole family is sick. A child comes from a family, from an extended family, they have siblings. Everybody is worried about that sick child. So we take care of children with many life-threatening, progressive, and life-limiting illnesses. And some of these diseases are reversible, some are not. And we still find that 80% of our children are dying in hospital and in a lot of pain. So this afternoon, we have the privilege of having Catherine Abor. She's a palliative care trained nurse with over 14 years of experience working with children. So she's going to take us through what pediatric palliative care is all about. Feel free to type your questions in the chat as we go along. Then we'll be able to do a Q&A session after the presentation. So we are going to share the screen. And get on straight to the presentation. Welcome, Catherine.
Thank you very much, Dr. Nafula, for that kind of introduction. As you have been, the way, okay. Thank you, Dr. Nafula, for that good introduction. As I have been introduced, I'm Catherine Abor, palliative care nurse. So, my presentation today is on pediatric palliative care. And before we continue, let us now look at the objectives. So by the end of the session, you should be able to define children palliative care, understand the palliative care needs of children, differentiate adult and pediatric palliative care, describe the role of health professionals in identifying the needs of children. So, as you've been aware that when a child is seriously ill, everyone in the family is affected in one way or another. That's the reason why it is important that the child and the family get the support and care they need during difficult time. So, these are facts about pediatric palliative care. Almost 50% of deaths in children occur in Africa. And in sub-Saharan Africa, 16% of children born alive died before their 5th birthday, compared to 1.7% in the West. This is because in Africa, children present very late to the hospital, whereas in West, the early diagnosis is made to the children who are having life-threatening illnesses. Also, 60% of childhood deaths in Africa are due to cancer or HIV and AIDS. Approximately 166 children less than 15 years are diagnosed with cancer worldwide. More on facts, we find that cancer burden is increasing globally, including Kenya. So 80% of children with cancer still die in pain with minimal medication. And the survival rate of children with cancer are higher in the developed world. So what is palliative care for children? Palliative care for children is the active total care of the child's body, mind, and spirit. It is also involves giving support to family. So when you are dealing with palliative care for children, you deal with the child's body, mind, and the spirit. It also begins when the illness is diagnosed and continue regardless of whether or not a child receives treatment directed at the disease. So the diagnosis is made. When the diagnosis is made, we start the palliative care. So palliative care is for all. Palliative care is for all, like it is all for children and even adults. So what are the differences between children's and adult palliative care? While there is significant overlap between adult and children's palliative care, there are also significant differences in adult. So one, communication with children tends to be more difficult than adults. Why? You have to be at the level of children. Because if you don't present the way the children want, you will find that you will not go well with the children. So how do you approach these children? You approach them with good therapeutic approach. Is when you can meet their needs. Also, we have pharmacokinetics and pharmacodynamics of drugs which children differ from those of the adults. Children's understanding of death and dying, they understand death and dying separate. They cannot compare between death and dying as the adult. So they still don't understand about death and dying. And also we have ethical dilemmas. As you know, by law, children cannot give consent. So let us now come to barriers for palliative care. One of the barriers is the perception of healthcare providers. How do they perceive palliative care for children? First, they feel that they don't know about palliative care. They feel palliative care is difficult to learn. They feel that they don't have enough knowledge on communication skills. So they find that palliative care is more difficult for them to learn. Also, false hope for cure. There are some people who really feel that when you are on palliative care, you will be given false hope for cure. So you will find that most of people will not like palliative care. Also, we have inadequate assessment and management of symptoms. When you don't do enough, or when you don't have that assessment to children, you will not relieve the symptoms. For example, you will not relieve pain. So you have to do thorough assessment for the child to control that pain. Also, there is lack of research on pediatric palliative care, and this is an area which need palliative care. This is an area which need research. Also, lack of training and expertise. There is also fear of addiction of hastening death. People feel that when you are given morphine, the child will be addicted, or that one can cause death. And also cultural differences, whereby you find that most of people, they don't want to talk about death and dying or death because death is a taboo. So what are the aims of palliative care? Can anybody tell me one of the aims?
Maybe you can type in the chat as we go along.
Thank you. So the aims of palliative care is to seek the aim of palliative care seeks to prevent or relieve symptoms produced by a life-threatening medical condition or its treatment. So palliative care is all about relieving symptoms and improving the quality of life of the children. Palliative care offers help for children with such conditions and their family to live as normally as possible. And it also provides family with timely and accurate information and support in decision making. So palliative care is very important. It will give the accurate information to the family, to the children, and also in decision making. It also provides support to caregivers. So let us now come and see myths about palliative care. Because many people do not understand about palliative care. They believe that palliative care is most appropriate for patients who will likely die within weeks, which is not true. Palliative care is started when the diagnosis is made. And it is not true that when palliative care is being applied to any child or any patient, those people will die. That is a lie. Also, pain is a dying process, which is not true. Pain must be controlled when the child is very sick or the child is in pain. So when the child is in pain, it is important for the healthcare providers to control that pain. It is not good for the child to die in pain. Treatment stops when palliative care starts. It is not true. Palliative care starts when the diagnosis is made. Palliative care speeds up the process of dying, which also I feel it is not true. Raising the topic of palliative care with patients and caregivers robs them of hope. Palliative care affirms life. And also, it gives people hope. You will explain to them the meaning of hope and you give them true hope, not false hope. Talking about pain medication in palliative care leads to addiction, which is not true. Yes, it is not true that when you talk about pain medication already, you lead to addiction. Palliative care is only for people dying with cancer. It is not true. Palliative care is for all people with different life-threatening illnesses. And also morphine is given to speed up the dying process. It is not true. Morphine, when the morphine is given at the right time or at the for the correct purpose, the patient will not die because of the morphine. But death will just come, but it is not because of using morphine. So, which are these children who need palliative care? One, children who need palliative care, these are children with life-threatening conditions, for which curative treatments may be feasible but may fail, e.g. cancer, irreversible organ failure, like liver cancer or kidney failure. Children with conditions of extreme premature death is possible or inevitable. For example, cystic fibrosis, muscular dystrophy. So, premature death or the conditions of extreme premature death can also, palliative care will help these children to undergo those conditions. As we continue, that children with progressive conditions without curative treatment, e.g. Batten disease, lethal congenital syndrome. There are some people born with malformation or lethal congenital disease. Children with severe neurological disability, which may cause weakness, susceptibility to health complications, e.g. severe cerebral palsy. As we can see from the picture, that child who is on the wheelchair. So these are the conditions palliative care is dealing with. So now, who is a child? In Kenya, a child is from 0 to 18 years. Neonate is from birth to 28 days old. Infant from birth to 1 year old. Child is from 1 to 18 years old, as you can see from that. So let us now come to total suffering. These children who have been diagnosed with life-threatening illnesses, they go through a lot of suffering. And from the diagram, we have 4 domains, whereby we have physical, we have psychological, spiritual, and social. In physical, children, any patient may be a child or an adult. They go through a lot of physical pain, whereby you get that the child child is suffering from the side effects. The child is having insomnia because of pain, and maybe the chronic illnesses. When we come to psychological, the patient is angry at the late diagnosis, when there is failure of treatment, when there is disfigurement because of the disease, and also when treatment failed. It's like, I came to the hospital, I've been given the treatment, but there is no change. So the condition still continues, the child may still continue to suffer. When we come to spiritual, this is where people ask, why me? Why I'm suffering like this? Why my child is suffering like this? Or why my child is having cancer? So there are so many questions which will come in spiritual aspect. And also in social aspect, this is where you find that the person is not able to, the patient is not able to provide for his family. He will feel like he's a burden to the family, and also is not able to make any decision. So he will feel like he's abandoned, and also there's nothing that he can do in that family. So that person will have social pain. So on the other hand, we can also find that all these children, they have their own needs. They have different needs. And this one will depend on the age and the developmental growth. For example, physical needs for these children. Children with cancer and HIV, they have complex psychosocial issues, belief systems, rituals surrounding death and dying. So what do they need? At that stage, they need what they need. They need food, they need care, they need love, and they need acceptance. Psychologically, they are affected because most of children with HIV, they will feel isolated, rejected. They are not playing with other children because of their health conditions. So in that case, also they need to be loved, to be accepted the way they are. And also in social needs, most of children, they like staying together with their parents. That maybe the siblings, the friends, they like to play together. But when they are sick, you will find that they will not be together. So children will feel lonely, they will feel isolated. And also when it comes spiritual, they will ask the meaning of life. and also hope and death. Is there any hope? Am I going to die? So we are seeing that total suffering is covering the four domains of physical, psychological, social, and spiritual. So how can we support these children? We support them because even if the child is sick, the child needs to play. The child needs to continue at school where possible. When the child is not very sick, please encourage the child to go to school. Involve children in family and community life because they form part of the community. And also make a space for spiritual support. If you know that you are not able to support the child, you can refer to the chaplain so that they can take over. Also understand the different reaction to loss. People react differently when they're having loss. So the way the mother will react or the child will react, just understand them. And also give extra love and attention to these children. They need love and they need attention. So we are still continuing with palliative care needs of children. All children have different needs at different ages of their growth and development. Age 0 to 1, they need love, they need warmth, they need security, they need physical contact and bonding. Those are the needs of the age 0 to 1 year. When it comes to 1 and 5 years, their needs are approval, they need attention. They need the attention from the caregivers. They need set boundaries. When these children are playing or wherever they are, the place should be safe. They need opportunity to explore. This is the age where they do a lot of exploration. And also they need independence. They want to talk, they want to walk left and right without any assistance from the family members or the caregivers. Also, we have ages from 6 to 12 years. They need mastery, they need recognition. And lastly, 12 years to 18 years, they need more freedom. They need direction to future life and also to find their own values compared to parents. They want to talk about whatever they want. They don't want to hear from their parents. So, what are the needs and the rights of these children? One, we find that all children need to be provided with the basic requirements for survival, growth, and development. These children need protection from abuse and neglect. It is also the right for that child to be protected from abuse and neglect. They need protection from all forms of exploitation. We find that these children with HIV or AIDS, they are being exploited. You will find that they work in the sugar plantation or coffee. They are being exploited. So they also have rights they have right to be protected from all forms of exploitation. They also need to access to health and health services. That's a need for these children. But also it is their right to access health and health services. It is also important to give appropriate information to these children, whether they're having multiple conditions, they still need that information. They still need to be heard. And also it is their right to have that information. As we still continue with needs and rights of children, they need privacy. For example, the child is having HIV, is having a lot of complications. it is not right to expose that child when you are doing any procedure. It is important to give that child privacy. And also education is also a need for these children. They need to go to school. They need to socialize with the other children. They need to play with the other children. And also it is a right for them to have that education. Also, they need freedom of association. Children need to work and associate with other children. They need recreation. They need leisure opportunities. It is also their right to have that recreation and leisure opportunities. So, palliative care. Palliative care is not merely holding hands or possibly as accepting dying. It is not merely holding hands or possibly accepting dying, but palliative care requires intensive attention to physical comfort. That child should be pain-free. They need active exploration of concern of both patient and family. So it is important for you as healthcare providers to find out their concerns, to find out their fears and concerns so that you can talk and also explain to them. Also, palliative care requires readiness to attend to disturbing emotional issues. We have seen many patients in the ward who are really having disturbing emotional issues. It is important to sit next to that patient, ask the patient what's the problem, sit there, listen to what the mother or the father is telling me about the child. You will get a lot of information from the parents, even for the children. But that one also will depend with the age and developmental growth. Commitment to dealing with the death as openly as is tolerated by the patient and family. When dealing with the patients, please try to be open as tolerated by the patient. Don't just give information of loss. When the patient is not ready for that information, please just leave it at that. Or if the child is not ready for that information, don't go beyond their need. So let us now come to health professionals in identifying needs of children. The role of health professionals in identifying needs of children. One, they identify and discuss the children's problems pertaining to his or her family ill health and respective cause. So it is important to identify that problem, discuss it, so that they may know exactly what's the cause. Categorize and identify the nature and the need, e.g. physiological, psychological, or social. Also discuss other needs of the child in relation to the cause, effects, and possible alternatives. Support the child to express their feelings. Allow the child to express whatever he wanted to say, and provide information on other available services for referral. If you have talked to the family members, you have talked about the diagnosis, you have talked about the treatment, and you have seen that the child will not benefit from there, then you can refer this patient to the nearest health facility. But before, you have to give the information to the patient or the caregiver. So after talking about palliative care, after talking about the needs of the patients, we now come to communication in palliative care. Communication is the foundation from which assessments are ascertained, goals of care are developed, and relationships are established. So communication is very important in palliative care when dealing with the patient and the caregiver. The concept of communication is very comprehensive in that it is important of all human interaction, including not only words, but tone, gesture, sound, touch, and the use of many other symbols. So communication is very important. How do you talk to that child? A touch that can make a smile, and any other many symbols that you may use is also a part of communication. So why do you think communication is important? It is important because it enhances relationship between the patient and the caregiver. It reduces uncertainty surrounding the diagnosis, the treatment. It also gives the team, patient, and family direction to follow. It enhances collaboration with multidisciplinary team. So when you are communicating with children, you know very well that palliative care, you cannot work alone in palliative care, but you work as a disciplinary team, whereby everybody knows where they should follow or the place the part is taking. So when we come again on communication of children in African context, in most African tradition, children are not seen but not heard. Children are seen but not heard. That is the tradition of African culture. Most African cultures tend to caution their children from bad news to illness or death. Because if you tell bad news to the children, they believe that the child will die, or discussing about death, as Ali mentioned, death is a taboo. Children not allowed to disagree with adults. So whatever the adults have said should remain like that. They are brought up and always instructed to be quiet and humble, never to talk when others are talking. So whether the child is in pain, they should never talk. They should just keep quiet, even if they are suffering. So one of the hardest things to bear is the realization that a child will not recover from their illness. As healthcare provider, this is where we get things very tough. How am I going to start talking to this mother about the diagnosis? How am I going to tell him that the child will not recover? So it is very hard for healthcare providers to talk about that. Talking about child's illness and death with them is probably the hardest aspect of dealing with terminal illness. They find it very hard. They don't want to talk about it. They will just leave the patient or the caregiver without giving that information. And you will find that the mother or the father is really suffering if she doesn't know about the diagnosis or what is really going on the treatment or in the diagnosis. So communication problems are common because fear. Most of us fear about how am I going to tell the mother? So what I will do that I will avoid the mother, so I'll not tell her. Feeling of incompetence, you feel that you are not able to do it, and you feel that you will be blamed in case a child dies or what, or any problem. You feel that you will be blamed. So let us now come to barriers to communication with children. You will find that barriers to communication with children appearing to be judgmental. You want to impose whatever you want to the child or the mother. Being patronizing or interrupting. Anything the child is talking, you want to interrupt. Whatever the mother is talking about, you want to interrupt. And also second guessing what they are trying to say. So it is not good to guess what children or their parents are trying to say. Just let them say what they want to talk about. You should be there and look, see or hear what they are telling you. Using a a commanding voice or tone. Remember that you are not at war with children or with a patient. So you should not use that commanding voice. You should use a good tone to the children or the parents. Showing displeasure with them. You are not interested in whatever they are talking about. They will leave you when you want to do any examination or you want to do any assessment, because you don't show any interest. They are also not interested in you. Not keeping your words. For example, you may tell the child that tomorrow I'll come and see you and I will bring bananas to you. The next day when you go, you don't carry that banana. So you are not keeping your words. And stop arguing with children. You should not argue with them. Children, they are very honest. They are very honest with whatever you tell them. So when you are giving them, you don't show any maturity as healthcare provider. Also making promises that you can't keep. Yes, it is good to give the promise that I'll give you this. So the next day when you come, you give them. So we have also effective communication in children, whereby children speak 3 languages: body language, play language, and spoken language. Body language, it is important to check or to assess how the child enters in the room, how the child sits on the chair, how the child is sitting on the chair, how is there any body, if the child is having relaxed, if the body is tense or relaxed, or if the body is changing according to any topic you are discussing. Also, play language. It is also important to children. Whenever they play, they communicate what they want from their hearts and their minds. And also spoken language, which they learn from their parents. So this is a play therapy, whereby you find the child is playing with the toys. This is one way whereby the child can tell you what is doing. Also, we have art therapy, whereby children really like to draw, and sometimes they draw from what is really disturbing them. As from the diagram, you can see another child is crying. So they really like to play or to draw anything they want to, anything that wants to come out from them. As we continue with the art therapy, you can see here they have draw the good pictures there. Yes, yeah. So, take home message. Good care depends to great extent on efficient communication between the clinician, patient, and the family, and within the whole healthcare team. So that's the end of my presentation.
Thank you, Catherine, for the good presentation. I hope we've learned a bit about the differences between adult and children palliative care. So we'll go to the comments and questions. So Rafael Langat asks, palliative care is mostly for patients with terminal diseases. What is the major message to the patient? Thank you. So I think what he's asking is many patients who are referred to palliative care have life-limiting, life-threatening diseases. Some might be in the terminal phase of their disease. So what should we be communicating with the parents, the children?
Okay, palliative care is all about improving the life of patients and their suffering. So palliative care is for all.
Yeah, so palliative care is actually about improving the quality of life of the child and their parents. And as you've heard, the definition is that it is the total care of the child's body, mind, and spirit. So our focus should be on encouraging the parents, not killing their hope, even when the disease is terminal, that there's still something we can do for them, and just encouraging them to allow these children to be part of their part of the siblings, play, you know, the things that children normally do. Even if they are sick, they're able to do them to some extent. So the message should be, we are caring for the child to the best of our ability. We are not giving up on the child at any point. Morris says, make children feel appreciated, mainly emotional and psychological support. We totally agree with that. You've heard from the presentation that a lot of focus has to go on the emotional well-being, the spiritual well-being of the child. Now, when does one detect behavior change in a child?
When does the one detect behavior change in a child?
Or how do they detect the behavior change?
Okay.
The other comments are about CPD points. Then, yeah.
I think I've answered this one. I don't know whether it's satisfied.
Zephania, I hope your question has been answered. Now, the other questions are about CPD points. I think the research department will coordinate about the missing CPD points. I've seen some concerns about the CPD points. So we would like to end there, and we want to end by saying that our children need palliative care, and it should not be denied. When we get them with a diagnosis that is likely to need palliative care, please refer them. So palliative care is given at any point of the illness, and the needs change with time. So sometimes we get children at early stages of disease, their families or the children themselves need psychological support. And as the disease progresses, they need more interventions or more treatment, more physical support. So let us continue holding their hands, the hands of the family, the hands of the children. And on Thursday, as part of our endeavors for creating awareness for pediatric palliative care, we are going to do play therapy for our children in Ward 3D. As Catherine has said, the language that children understand, one of them is play. So we want to motivate them a bit to make them feel like children, so that they can feel good even if they're in hospital and they're very sick. They still need to do activities that relate to their age, their relevant ages. Thank you so much for your attendance. Tomorrow we will do the final series in these presentations, and we'll be looking at what the World Hospice and Palliative Care Day is about and a bit of history of palliative care. Thank you for your time. If there's any burning question or concern, you can send it to knh.research@gmail.com.